Hey everyone, and welcome. Today we're diving into something you've almost certainly seen, maybe even on your own legs, varicose veins. Now, it's so easy to dismiss them as just a cosmetic issue, something that doesn't look great in shorts, but the truth is they can be a flashing warning light for something much more significant happening just beneath the skin. So let's get into it.
So just how common is this? Get a load of this number. 50%. Our sources show that the underlying condition, chronic venous insufficiency, is actually the most common vascular disorder out there. It affects up to half the population. I mean, think about that. That's a staggering number, and it makes this a topic that really all of us should understand.
All right, so let's start with the absolute basics. When you and I talk about varicose veins, what are we actually seeing? What are we looking at? This first section is all about just identifying them.
Okay, this clinical definition sounds super technical, right? But let's just break it down into plain English. Dilated just means they've gotten wider, they've stretched out. Subcutaneous means they're right under the surface of the skin. And tortuous, that's just a fancy doctor word for twisted and winding, like a garden hose that's gotten all tangled up. So, put it all together, we're looking at enlarged, twisted veins that are so close to the skin you can see them as bulges.
Now here's where it can get a little tricky. Not every bulge, especially in a place like the groin, is what it appears to be. And this leads us to a pretty common point of confusion that doctors have to navigate all the time.
The key here is telling the difference between a saphenous varix, which is a type of varicose vein, and a femoral hernia, because they can look really similar. So doctors have to do a little clinical detective work. The varix is usually softer, and it can have what's called a fluid thrill. It's this distinct little vibration you can feel if the person coughs. Now, both might seem to disappear when you lie down, but only the varix will refill from the top down when you stand back up. It's all about gravity.
Okay, so now we know what they look like. Let's get to the million-dollar question. Why? Why do they happen in the first place? What's the actual mechanical failure going on inside our bodies?
And here it is. This is the heart of the whole issue. Inside your veins, you have these incredible tiny little one-way valves. I want you to think of them like one-way gates in a plumbing system, right? Their entire job is to keep blood flowing in one direction, up towards the heart. Venous valve dysfunction is just the technical term for when those little gates get weak or damaged and they don't close properly, allowing blood to leak backward and pool up.
So what makes these little gates start to fail? Well, as you can see, there's a whole list of risk factors. Some of them, like getting older or your family history, are just the luck of the draw. But others, like standing on your feet all day for work or carrying a higher body weight, put a ton of extra pressure on those veins day in and day out. And pregnancy is a big one too, because of hormonal changes and just the physical pressure on the whole system.
Okay, this is where we need to shift our thinking, because for so many people, varicose veins are just about looks. But ignoring that underlying problem, the leaky valves, the pooling blood, can lead to some pretty significant medical trouble down the road. Let's dig into what happens when this stops being cosmetic and starts getting serious.
You can really think of it as a chain reaction. It all starts with the valves failing. That failure leads to high pressure building up in the veins. That's called venous hypertension. Over time, that intense pressure starts forcing fluid out into the surrounding tissues. That's when you get swelling or edema, and you might notice the skin starts to get hard and discolored. And in the most severe cases, it can lead to these painful open sores called venous ulcers that are just incredibly difficult to heal.
And now for a term that sounds like it was pulled straight out of Greek mythology. Because while most of the varicose veins we talk about are in the legs, sometimes a very, very specific pattern of veins can show up somewhere else on the body, signaling a completely different and very serious problem.
This is caput medusae, and it's pretty wild. It's this sunburst pattern of swollen veins that literally spreads out from the belly button. Now, this has nothing to do with the valve failure in your legs. Instead, this is a massive red flag for severe pressure buildup in the veins around the liver, a condition known as portal hypertension. It's just a powerful reminder that sometimes the veins you can see are telling you a critical story about what's going on deep inside.
So with all these possibilities and potential complications, how do doctors get a crystal clear picture of what's really happening? Let's take a look at the diagnostic process.
So here's a classic physical exam technique, and it's actually pretty clever. First, the doctor elevates the leg to drain all the blood out of those surface veins. Next, they apply a tourniquet up high on the thigh to act as a temporary dam. Then, the patient stands up, and the doctor just watches.
If the veins fill back up slowly from the feet, that's good. It means the deep valves are working. But if they fill up super fast from the top as soon as the tourniquet is released, bam, that's a clear sign of a major valve leak up high. Now, those physical tests are still useful, but today, the absolute gold standard is the duplex ultrasound. It's a total game changer. It's completely non-invasive, and it gives doctors a direct view inside. They can literally see the structure of the veins and watch the blood flowing in real time. It lets them pinpoint exactly which valves have failed and basically create a complete roadmap of the problem. All right, so the diagnosis is in. The problem is mapped out. What's next? Let's walk through the treatment options, which really run the gamut from simple lifestyle tweaks all the way to some pretty sophisticated medical procedures. You know, for a lot of people, especially if things are caught early, treatment doesn't involve a procedure at all. The first line of defense is this conservative care. Simple things like putting your legs up, managing your weight, and yes, wearing those famous compression stockings, they all help reduce the pressure in the veins and give your circulation the support it needs. Now, for more serious varicose veins, you got to bring in the interventions. And wow, look at the difference between the old and the new. The traditional method was surgical stripping, a pretty major operation, often under general anesthesia with a long recovery. Today, the standard is thermal ablation. A tiny catheter is guided into the vein, and heat from a laser or radiofrequency is used to just seal it shut from the inside. It is minimally invasive, recovery is way faster, and it's often done right in a doctor's office. It's really amazing. And there are even more tools in the toolkit. For smaller spider veins, there's sclerotherapy, where a solution is injected to make the vein collapse. For some of the lumpy tributary veins, there's something called a stab phlebectomy, where they're physically removed through tiny little incisions. It really just goes to show how customized the treatment can be these days. So we end up right back where we started. After looking at the causes, the risks, the complications, and all the modern treatments, the question for you is that vein on your leg just a cosmetic issue, or is it a sign, a signal that your body is trying to get your attention? Because recognizing that difference, well, that's not just about how you look. It's the very first step to taking real control of your vein health. Thanks for joining me.